Hi, welcome back to the Medicare Show. I'm your host and Medicare advisor, Jeff Kuhn. It's been a few minutes since I've posted a podcast and a video in a little while, but it's long overdue. This one in particular, I've been getting a lot of phone calls on with clients asking about how do they get the weight loss drugs that are now covered under Medicare. So I'm going to give a brief overview during this podcast of what's involved and really what you need to do, but I've got other information. I'm going to let you know the easiest way to get it. It's a summary of what to do with that program. Just get everybody caught up. I've got a lot of things that have been going on over this, I'm going to say late spring, early summer. It doesn't feel like summer has just gotten here. But started doing a radio show. I've got two other co-hosts on WHAM 1180. You can go on to iHeartRadio. It airs every Saturday at 11 o'clock for an hour. We've got some great information on there about finance, health, law. It's just a great group of people doing this show. So I hope you're able to tune in and enjoy it. I do have a great summary sheet with these GLP-1's that I've just got it down to one page. And I actually share this with a doctor, and the feedback so far is this is really, really easy sheet for them to even use. I was speaking with a doctor yesterday, and I said, how's it going? Because as of July 1st, we can now start getting some of these weight loss drugs covered under Medicare. Now, it's a little weird how it's going to work. I'm explaining that whole process in a second. But I said, have you done it? What have you found so far? And they said, yeah, we've got a bunch of clients or patients. As of July 1st, we submitted this for, and we have not heard anything back. So it's kind of explaining how the program works. And, we've got people calling and go, what do I need to do to get this? There's a couple things. One, yes, it's covered by Medicare, but it's not covered under your prescription plan. You do have to have one. It's kind of weird, and that's where this starts getting confusing. So if you've got a standalone Medicare Part D plan, if you have Medicare Advantage plan, you're eligible to participate in this. Now, if you've got some of the qualifying conditions that would have made you eligible for this under Medicare, not for weight loss, but for diabetes and some other things, you're excluded from being eligible for this particular program. And it's kind of weird how this is going to work. But your doctor's got to submit a prescription to your pharmacy, specifically for weight loss, which isn't covered by your drug plan. Now, what's going to happen is it kind of gets rejected, and then the doctor's got to fill out a prior authorization request to get it covered. And it goes through this program. And there's really three prescriptions that are going to be covered. I'm going to read the one. I'm not sure exactly how to pronounce it properly, but it's Foundayo or Foundayo. That's actually the one that's a tablet now. You've got Wegovy and you've got Zepbound. So those three are going to be covered. Now, the catch with this is this prior authorization is going to go through. It does go through Medicare, CMS. This program is available through the end of 27. The great thing about it, and this is really going to be helpful for the people that are out there that are currently paying $450 a month for weight loss directly through the manufacturers. You're now going to be able to get this for $50 a month, which is a big, big savings. The thing to know about this is you're not going to see it in your monthly explanation of benefits from your drug coverage. It's going to be covered separately. The thing with the $50 a month that you need to know is this. There's a couple things. One, it does not count towards your annual deductible for Medicare. And currently in 2026, that annual deductible is capped at $615. Nor does the $50 you're spending every month, that's not going to count towards your max out-of-pocket of $2,100. So this program is going to run kind of parallel with your current drug coverage. It doesn't combine the deductibles or your out-of-pocket max with them. The great thing about it, and the people that are getting these prescriptions covered now for diabetes, for other pre-qualifying conditions, you're going to think, well, I'm paying a lot more because if I take my $2,100 out-of-pocket max for prescriptions, well, that works out to $175 a month. That's what you're going to be paying for prescriptions. It would be cheaper to do it for weight loss for $50 a month, but you can't do it. They've excluded you from that. The other thing for weight loss, they do require your BMI to be at least 35 or higher. So keep that in mind. Now, what I do know about this program, they've said, is with the GLP-1s that are covered is what's called a bridge program. So what happens is once your insurance company rejects it, then your doctor submits this authorization. It goes to this bridge program. Now, what I've heard is Humana is actually going to be the insurance company that's going to be running this for CMS. You don't contact them directly, but that's who's going to be administering this. So once that gets approved, we don't know yet how long this is going to take, but we do know we're now a good week or so into some of the doctors that have been applying for this, and they haven't heard anything back yet. But this sounds like it's going to be a great program for people that need this for weight loss, because the folks that have been taking it for other reasons have lost the weight. There's a lot of other medical benefits once that weight comes down. So we're really looking forward to our clients being able to get on this. We're going to keep you up to date on it. But as of right now, everything is in place for it, although it does seem confusing. Now, if you want this one-page cheat sheet, it's helpful for doctors. If you want to give it to your doctor, certainly I'm happy to email this to you. Feel free to send me an email directly at email address is simple. It's the Medicare Shop, and that's spelled SHOP, @gmail.com. So if you shoot me an email, say, hey, Jeff, can you send me your cheat sheet on the GLP-1s for weight loss with Medicare? I'll forward this right over to you. So hopefully you found this video helpful. Look forward to giving you some additional information on it as soon as it becomes available. And we're into July, so we're starting to get updates on drug coverage and some other things for next year. So expect some more information coming out here in the near future with the podcast. And thanks again for joining me. Bye-bye.